Good morning, everyone. Can you all hear me? Perfect. Yeah. Thank you. Thank you. We're going to give the others about 2 more minutes to join us, and then we'll get started. Okay, that was the indication that it is 7 a.m. So we will go ahead and get started. Good morning. Thank you so much for joining me. I'm Brandy Benson. I'm the Executive Director for Network 5. You have registered for an information session. We have heard for the past several months now that there are many new staff members within the dialysis clinics, and through the pandemic, the network kind of interacted with the facilities a little bit differently. A lot of our quality improvement activities were put on the back burner to help provide the space in the room for dealing with the pandemic. So these are kind of some information sessions to just provide reminders and information about the network. Let me figure out why my slides aren't advancing on the set that you're seeing. Let's see. There we go. Just 2 quick housekeeping items. One, the lines are on mute. You can take yourself off of mute. That's just to help keep the background noise down. And then I'm going to ask you to use the chat to ask questions if you prefer. Otherwise, you can certainly come off mute and ask questions. If you want to ask questions throughout the presentation, I'd be happy with that. It's a fairly small group this morning, so it's easy to do that. Or wait until the end, whatever you're most comfortable with. So a little bit of background information on the ESRD network program. Across the country, there's 18 ESRD networks, and those are geographic areas defined by CMS. And within those geographic regions, there's an organization that serves as the ESRD network organization. And those organizations are contracted with CMS to support achieving national quality improvement goals and statutory requirements. The network goals align with the Department of Health and Human Services national quality strategy, as well as CMS's quality strategy. And the networks are required to conduct specific quality improvement activities focused on patient care, maintaining a patient registry. You all know that as EQRS. We provide educational materials and investigate patient grievances. I share all of this with you to let you know that the goals that the network is pursuing by working with the dialysis facilities within the network are not derived from the network. These are not ideas that we came up with. This is contracted This is a requirement of CMS because they have an overall strategy, and this is what they need the dialysis providers to do to achieve those strategies. Then the conditions for coverage is really what holds everyone accountable. So you all are probably familiar that CMS established these regulations that in order for a dialysis facility to be certified under Medicare, they have to follow the conditions for coverage. And so what that means is in order for the facility to be reimbursed by Medicare, then they need to be a certified facility by Medicare and pursue the conditions for coverage. One of the conditions includes the dialysis facility must cooperate with the ESRD network designated for its geographic area in fulfilling the terms of the network's current statement of work. Each facility must participate in ESRD network activities and pursue network goals. This is the bulk of what we're going to talk about this morning, are the network goals, our statement of work. Our statement of work is really the contract with CMS. So what they have outlined for us to work on, the goals that they have assigned for us to pursue, and your role in all of that. And then we partner with the state survey agencies to ensure that the conditions for coverage are met. So you might be familiar with the state showing up at your facility to do a recertification or a drop-in visit. They always call us before they go in. They want to know what projects you're working on with us, how you're performing, pursuing our goals, your overall engagement with us, any grievances that you all have had. They're already aware of involuntary discharges. That's one of the requirements, is to also let the state survey agency know about those, but we remind them if your facility has had involuntary discharges as well before they go in to do their visits at the facility. So your network is ESRD Network 5, Quality Insights Renal Network 5, that's us. We're the organization that has the contract to do this work in the Network 5 region. We're formerly known as Mid-Atlantic Renal Coalition, or MARC. So if you remember MARC, if you remember Mid-Atlantic Renal Coalition, same. That's us in a new name. Name changed several years ago now. 2017, I believe, is when the name changed. We still cover Virginia, Maryland, West Virginia, and DC. It's about 451 dialysis facilities. It comes and goes a little bit with closures or temporary closures. 14 transplant centers. Over 28,000 dialysis patients are within our region, and 17,000 transplant recipients. I'm going to introduce you quickly to the network staff. Several of us have worked with you all for many years if you've been around. Myself, Brandy Vinson, Heather Cecil, our outreach coordinator, has been with the network for over 20 years. Andrea Moore, our health equity specialist, has been with the network for over 5 years, but in several different capacities, and is currently working on health equity. Our primary data staff is Allison Crittenden. She has been with the network for 22 years, and I know many of you are familiar with her. Our patient engagement staff, Renee Bovacalis, one of our social workers who serves as a patient engagement specialist, has been with the network for over 17 years, working with facilities on patient and family engagement, resolving grievances, involuntary discharges. Renee is the go-to. Phyllis Haas joined us almost a year ago and is working with facilities and patients primarily on grievances and involuntary discharges. Then we have our quality improvement team, Caitlin Booth, Elizabeth Noche, and Amanda Morelli. These ladies have been with the network for a variety of stints. Amanda has been with us for 5 years, Elizabeth just a few months, about 6 months, and then Caitlin a little more than a year. As you can see, Caitlin and Amanda are nurses. Amanda was a former dialysis nurse and facility administrator. Elizabeth is a dietitian that formerly worked in a dialysis unit, and then Caitlin Booth, also a nurse, has a master's degree in nursing education, which has been very beneficial for us, and has experience working in the ICU and in vascular access centers. So this team is the team that primarily works with the dialysis facilities on pursuing the network goals and working through quality improvement activities. So some overall information about the network goals. First, facilities are assigned specific goals. So we use information from a baseline period that is specified by CMS, and we assign goals to you to help overall the network achieve these goals. For this performance period, goals were announced during our virtual council meeting held in May. And that was just overall pursuing what the topics that the network was pursuing. Of course, your individual goal was not announced at that meeting. The goals are attached to the facility/network membership agreement that is renewed in September. So every single facility in the network has to have a membership agreement with us. Those are renewed, signed every September, and we attach the goals to that so that you are aware of what we are pursuing. The goals are posted to our website, which of course is qirn5.org. And then individual facility progress is tracked by logging into your ESRD facility report. So that is where you're going to see your individual facility's goal and how you're progressing towards those goals. The goals that we're working on right now need to be achieved by April 30th, 2023. And the current performance period is May 1st, 2022 to April 30th, 2023. This is really important to understand because it doesn't align with the quality incentive program. It doesn't align with the ETC model you might be working within, that payment model. It doesn't align necessarily with your corporate goals. This is a very specific 12-month period that CMS has selected for us to make improvements in. This is, important to understand this period, because when you see your data, if it doesn't align with what you think that it should, it could be because your achievement happened prior to May 1st, 2022. So to give you an example of that, if your data shows your data that we have on our on your ESRD facility report might show that you've had 2 patients added to the wait list. If one of the patients was added, if you believe you have 4 patients added to the wait list, but they were added in March and April of 2022, then that's not going to be captured in our data set because we're only looking at the additions since May 1st, 2022. Okay, so now we're going to get into these specific goals. Again, this is not going to be your facility. I'm going to let you know if the measure applies to your facility, but your specific number, the goal that you're trying to achieve, is not going to be displayed here. There's no way to share that in a public setting with 450 facilities. So the first area that we're working in is data quality. And for CMS, what they're looking at is improving the data quality of the ESRD registry. And like I mentioned earlier, that's EQRS. That is how Medicare keeps track of all the ESRD beneficiaries, the patients that they are providing dialysis for. So the goals for this project area are based off of your performance during the baseline period of January 1st through December 31st of 2020. So calendar year 2020 is what the baseline is. So everything we're trying to do to improve is based off of that. We're trying to do better than we did in 2020. The data source for these measures are EQRS, and these measures are applicable to every single facility in the network. There are no exceptions here. So what we're trying to do is increase the rate of admissions entered into EQRS within 5 business days. So when a patient comes to your clinic, that needs to be updated in EQRS within 5 business days of that patient coming to your facility. Getting the form 2728 entered on time, that's within 45 days. And then the death notification form, which is the 2746, entered into EQRS within 14 days of the death. Moving on, the other focus area is in modalities. So from CMS's perspective, they are looking at improving care in high-cost, complex chronic conditions. And so as that trickles down to the network, they are again, goals were established based off of performance in 2020. So however you did in 2020, we're trying to improve that. And the data source here is EQRS. And of course, home modalities. That's overall one of the areas we're trying to improve. So there's 3 measures that fall under home modalities. The terms that I'm going to use here, direct to home, transition to home, telemedicine visits, are the same terms that are used on the ESRD facility report. We'll get into the specifics right now, and you can let me know if this is clear or if you have questions. So direct to home, what we're trying to do here is increase the number of ESRD patients that start dialysis utilizing a home modality. You'll often hear the network staff talk about incident starts, but in this case, this means the very first treatment that this patient ever receives is a home modality. So it's not within the first 90 days if the patient starts a home modality, it's that very first treatment. With that being said, this goal is only applicable to facilities that offer home dialysis, regardless if you're enrolled in a network project or not. So if you don't offer home at your clinic, then you're not going to have any opportunity to have a patient start home on their very first visit. So you're not going to have this as a goal. The next area of focus is transitions to home. And so this is transitioning dialysis patients that are utilizing an in-center modality and then transitioning to a home modality. Home-only facilities are excluded from this measure because, again, if you don't offer in-center, if you're home only, you have no in-center patients to transition. So let me clarify this because I know a lot of people have been confused by this piece. If you are an in-center only facility, that means you don't provide home at your clinic. But a patient leaves your clinic and goes to a home clinic and starts a home modality, you're going to get credit for that because you transitioned a patient from in-center to home, regardless if it was within your own center or not. Again, this measure is applicable to all other facilities. So facilities that offer multiple modalities or in-center only, you are working towards this goal, and it's regardless if you're enrolled in a network project or not. The final focus under home modalities is increasing telemedicine visits, and this is for home patients that live in a rural area. So this is based off of where the patient lives, not where the facility is located. The patient is a home patient, and they are utilizing telemedicine visits. This is applicable only to facilities that offer home modalities and have patients who reside in rural areas. Again, regardless if you're enrolled in a network project or not. There is an additional data source for this measure, and that's Medicare claims. That's one of the ways we find out if there was a telemedicine visit. If your facility is pursuing this goal, then more than likely you would have heard from Elizabeth about the specific patients that have an opportunity who really fit this very strict criteria. It's a fairly small number throughout the network. So you would have been notified if you have patients that fit this criteria and should be pursuing this goal. All right, so still under modalities, we are trying to overall increase access to transplantation. So the first step of that is increasing the number of patients added to the kidney transplant waitlist. So I bolded and underlined added because this is not looking at overall the percentage of patients you have on the wait list. This is looking at how many patients you have added to the wait list during this performance period. The additional data source here is UNOS, and this is applicable to every single facility in the network, regardless if you're enrolled in a network project or not. Under this same area of focus is transplanted, meaning increasing the number of patients actually receiving a kidney transplant. UNOS is also an additional data source used for this measure. Again, applies to every single facility in the network, regardless if you are enrolled in a project. Now, I do want to say, we realize that beyond donating your own kidney to a patient, this is a very hard goal to achieve for dialysis facilities to really have a big influence in pursuing this goal. So what we're looking for is that you help keep your patients active on the wait list. If they're not active, then they're never going to get the call that a kidney is available for them. Talking to patients about high KDPI kidneys. So being willing to accept a kidney that is a little more higher risk. If you're not comfortable with that education, then having lobby days with transplant centers to encourage them to talk to patients about accepting those types of kidneys. Living donation, like these are the areas that you can help bring information to patients so that they're more informed and help increase their chances of being transplanted. All right, moving on to hospitalizations. CMS is looking to overall improve and maintain the health of ESRD patients. The goals for these measures are based off of your performance during June 1st, 2021 to October 30th of 2021. That's a typo. I need to fix that. So June 1st, 2020 to April 30th. The data source is Medicare claims. What's tricky here is we're only looking at hospitalizations for certain priority diagnosis categories that occur during this time period. So it's not every single hospitalization, it's hospitalizations that CMS felt that the dialysis facility could have an impact on preventing. And this is applicable to every single facility in the network, regardless if you're enrolled in a project or not. So breaking it down to the specifics is decreasing hospital admissions, decreasing outpatient emergency department visits, unplanned 30-day readmissions, and then COVID admissions. So that is the primary diagnosis was COVID, and the patient was hospitalized. Okay, vaccinations. Again, for CMS, they're looking to improve care in high-cost complex chronic conditions. These goals are based off of your performance for calendar year 2020. The data source is EQRS. However, it's NHSN for COVID-19 vaccinations and staph influenza vaccinations. And these measures are applicable to every single facility in the network, regardless if you are enrolled in a project or not. So we need to see an increase of patients vaccinated for pneumococcal. Right now, our statement of work says PCV 13 and PPSV 23. The CDC has changed their recommendations for our patient population. Really what we want to see are that patients are vaccinated for pneumococcal. Utilize EQRS to report this data. All of the various pneumococcal vaccines are listed in the new vaccination module. Make sure that data is in EQRS and you will be golden in this measure. For COVID-19, we need to see 80% of patients receiving a primary series. So that's either 2 doses of Moderna, 2 doses of Pfizer, or 1 dose of Johnson & Johnson. And then 80% of those patients who receive the primary series also get a booster. And right now it is any booster. At any time, they need to have gotten at least 1 booster. And then the goal is still 100% of staff receiving the primary series and then a booster as well. What I really want to stress here is, again, for these measures, these 4 measures about COVID vaccinations, the data source is NHSN. And if your staff had contraindications or exemptions and did not get vaccinated, that staff member is in your denominator, but they are not in your numerator. So that means you are not 100%. As long as you have staff or patients who refused, contraindications, exemptions, you're not at 100%. Those do not count in the numerator, but are in the denominator. For influenza, patients and staff vaccinated 90%. Okay, patient and family engagement. CMS is looking to see improved patient and family engagement at the dialysis facility level. This is self-reported data that you all report directly to us. And these measures are applicable to every single facility in the network, regardless if you're in a project. We are looking to see facilities integrate patients and families into your coffee meetings, assist patients to develop a life plan, and then develop and support a patient peer mentoring program. Moving on to behavioral health. CMS has an overall strategy to improve behavioral health outcomes. The goals here will be based off of your performance in 2020. The data source right now is EQRS and Medicare claims, and again, applicable to every facility in the network. So what CMS wants to see is an increase in the percentage of patients identified as having depression and documented in EQRS. So part of the quality incentive program is you have to screen patients for depression at least annually. And then there are options in EQRS for you to report what the findings were. Overall, we need to see an increase in options 1, 2, and 3, which all say the patient was positive. But 1 says the patient was positive and there's a plan in place. Option 2 says the patient screened positive, but the patient isn't eligible for a plan. And then option 3 is positive, but no plan in place. I believe it are the correct definitions there. They're definitely all 3 that the patient was positive. So what this is based off of is the literature says that about 30 to 34% of dialysis patients are depressed. But when CMS analyzed the data that's reported for QUIP, it was only 7% of patients that screened positive. So they're interested in seeing where the disconnect is and want to see patients screened more thoroughly. We are aware that a lot of facilities use the PHQ-2 to do the depression screening, and perhaps those two questions aren't really capturing whether or not the patient is depressed. The second piece to this is then those patients who are positive, that we see an increase that they are receiving treatment. Because of the data sets that are provided, we are looking at patients with Medicare Part B identified as having depression, and then that they have received treatment by a mental health professional. Okay, then we have an area of focus on nursing homes, and this is CMS's interest in improving patient safety and reducing harm, to improve nursing home care and low performing providers. These goals are established off of performance in calendar year 2020. Data sources are EQRS and Medicare claims. These measures, so listen up, these measures are only applicable to dialysis facilities that provide home dialysis to patients who reside in nursing homes, regardless if they're in a project or not. So this is a very small subset of facilities in our network. Again, if you provide home dialysis to patients that reside in a nursing home, then these measures are for you. We're looking to decrease hemodialysis catheters in that patient population. Catheter infections, I think I left out that part. Decrease the incidence of peritonitis in that patient population, and then the rate of patients having a blood transfusion in that patient population, that nursing home patient population that's receiving home dialysis. All right, we're going to do a pulse check real quick. I've mentioned throughout this presentation several times the ESRD facility report. These reports were launched online in July of this year. Facility administrators were first notified. They received the link to log in. They were provided usernames and passwords in the email that came from me. These reports provide individual facilities progress on the network goals. I mentioned that earlier. Last month, we included social workers on that distribution list. So now social workers and facility administrators are notified when the ESRD facility report is updated. We provide them the link and the username and password, and they are encouraged to go and take a look at the reports. We have 2 resources available right now online to help support the use of this report. One of them is a user guide, which is an 11-page PDF that walks the user through every single one of the measures, giving you a lot of information about the measures, very similar to what I've shared with you this morning. And then a quick video that's less than 4 minutes that can walk you through very quickly how to access and use the report. So here is the link to the report. This is the screenshot. So when you click that link, you would get to this login page. Again, you would use the username that I provided to you in an email. It's your CCN. It's your Medicare provider number, 6 digits, and then a unique password. Now, every facility has one username and one password that is provided by the network. So you are welcome to share that with whomever you would like. If you want to share it with all of your staff members, if you want to share it with corporate, if you want to share it with your regional leadership, whomever, you are welcome to do that. We provide it to the facility administrator and the social worker, and we have worked with a lot of various regional leadership and provided logins for facilities that they oversee as well at their request. So once you log in, this is the first page that you would get to. This one is actually looking at the measures for EQRS admissions. So every measure is set up the same way. You have a goal, which is the blue bar, you have a goal, which is the gray bar, and your progress is the blue bar. So this facility needed to get 7% of their admissions. That was their goal. And they have already exceeded the goal with 8.9%. So right here it says, yes, they've met the goal. Good job. How do they compare to the other facilities in the state in which they're located in, which is Maryland? They're in the bottom 25%. And then how do they compare to other facilities in the network? They're in the bottom 25%, because having 7% of your admissions on time is a very, very low threshold. And we certainly would like to see that improved even more than just 8.9%. So over here on the left-hand side is where you would verify we have this information correct. Your CCM, your facility name, the state in which your facility is located in. We tell you that you're in Network 5, which includes DC, Maryland, Virginia, and West Virginia. Services, this is really important. Make sure we have your services correct, because this is how the goals are assigned. Remember those goals that don't have the home goals specifically, that are only for certain types of facilities. So make sure we have services correct. This facility only provides home. And then we tell you the number of facilities in your state, so you can get an idea of how many facilities you're being compared to at the state level, and then the number of facilities in the network. And then you would just select the various measures over here on this menu over here on the left-hand side, and it would take you to a screen like this, but for your individual goal and the progress you're making towards the goal. Down here is also the data source. Using this purple button, you can download the report, because the expectation here is that you would discuss these measures, this report, your progress on network goals during your QAPI meetings. This data is refreshed once a month, so you can pull this up in your QAPI meetings, or you can download the report and take it to your QAPI meetings. I cannot stress it enough that when the network assigns goals, it's not assigned to a single person, it's assigned to the overall facility. So typically it's the facility administrator's goal, role and responsibility to bring the team together, to get a plan together on how these goals are going to be met, what's the actions that each of you are going to take, but it's not for one single person to own. So the expectation is that you do this monthly. Talk about network goals in your QAPI meetings. This needs to be documented, because at the end of the performance period, if you haven't met the goals, we might request to see those QAPI minutes to see how you were talking and adjusting and making plans to meet these goals. We ask that once a quarter you select this tab up here that says Facility Action Plan. There's a link to a Survey Monkey in there where we ask you to give us an update on how you're doing meeting your goals and actions that you're going to take to meet those goals. Okay, at the end of September, we launched a flu campaign. On October 4th, we requested action, and that was that every facility print this poster, which is the, it's a flu vaccine goal tracker. So remember I said every facility, patients and staff are supposed to be vaccinated 90%. So we ask that you print this poster and hang it in your facility and track your progress towards meeting the 90% goal, so that staff and patients can see your progress towards goal. This is a flyer, what is the network, that went out to a huge distribution list within the network, and it was actually attached to the email that you all received with the registration links for these information sessions. So again, trying to remind dialysis facility staff of who the network is, what we're here for, how we work together to pursue goals. We provide our contact information. On the 12th of October, this was sent and action was requested. We ask that you print this and hang it in your break room for staff members to see. Okay, so we are going to do a quick check-in on polls. So I'm going to ask you a few questions. Can you see these questions? The first one is, how many of you have the flu goal tracker poster that I just showed hanging in your facility? Your options are, yes, I've seen it. No, but I'll make sure it's hung right after this session. Or what poster? Second question is, how many of you have the what is the network flyer hanging in your break room? Yes, I've seen it. No, but I'll make sure it's hung after this session. Or what flyer? And then the final question is, how many of you have seen your facility's ESRD facility report? Yes, I've seen it. Yes, I've seen it. And we talked about it during QAPI. No, but I'm a facility administrator or social worker, so I'll look for an email from you. No, but I'll ask my facility administrator or social worker about it. Give everybody about 15 more seconds to answer. Okay, so let's see. We are tied with the flu poster as having it hung and needing to get it hung right after this session. The majority of you do have the what is the network flyer hanging in your facilities, so that's good news. And then we've got a variety of responses down here on the ESRD facility report. Love to see that the majority of you have seen it and that several of you have even talked about it during QAPI, but then there's a few of you that have not seen it and need to track it down. So after this call, if you're not able to track it down, send me an email and I will help you get a login so that you can access your report. Okay, thank you for participating in those questions. Okay, we have just a couple of more things real quick. Want to wrap up with the network expectations. So we expect dialysis facility staff to engage with us. We need you to respond to inquiries and requests for information. We need you to take action. When you see an email that comes from me or someone else at the network and it says action needed, that's what we're asking you to do. This is what we need you to do. We need you to sign up and read our electronic newsletter alerts. That's the easiest way to keep up to date with what's coming out of the network. We need you to notify the network of major events. So that's facility emergencies, even closures. We need to be aware of those things. When you have change in leadership and staff, you need to let us know that. It is very important that we have the correct contact information for facility staff so that when we are trying to reach you via email, phone, however, we have the correct information. We need to be help from you to inform patients of available resources. One of those things is the grievance resolution. Need to make sure that you have the grievance poster hanging ideally in your lobby, but somewhere that patients can see it very easily. Let them know about educational materials that are available from the network, and then opportunities for them to work with the Patient and Family Advisory Committee. And then we need you to pursue network goals. That includes participating in network quality improvement activities, engaging in network facilitated technical assistance, monitoring this ESRD facility report and talking with your teams about it in copy, and then providing feedback to us on the action plan. This is going to be your key to success. If you're doing these things, then life is going to be easier. We're doing various levels of monitoring. We're monitoring your engagement, so your communication with us, your responsiveness, the timeliness of your responses, and your effort. So when the network sends a deliverable to a facility, we'll use the quarterly personnel update. So each quarter, typically from Heather Cecil, the facility receives an email to update key positions that we need to know the name and the email address of these key positions. So again, we have our records updated. We need those answered completely. We need emails spelled correctly. Do not make up emails. Sometimes we will get, John Smith at whatever.com. Effort. Again, this is information we need so that we can contact you when needed. 99% of the time, if we are sending you something, there is a deadline attached to it. Sometimes it's our deadline, sometimes it's CMS's deadline. Regardless of the deadline, we need you to submit it on time. And then we're monitoring facility performance. So your performance towards our goals, and did you meet the goal? If you did not meet the goal, did you make progress on the goals? So if there's no progress on the goal, we will be digging deeper into the effort made to make progress. And unfortunately, there are consequences to not doing those things. There will be performance improvement plans that will include oversight by CMS and state survey agencies. There will be referrals to the state survey agency for facilities that are not cooperating or adhering to the conditions for coverage. That will be the problem. And we will recommend sanctions for facilities who have consistently failed to cooperate. The network has a deliverable that is due to CMS on May 30th of 2023, and that is to provide a list of facilities that have not cooperated. When you registered for this meeting, you had an opportunity to submit questions. We got one question from the audience. This person is hoping to understand transplant process and multiple listing coordination. I would recommend visiting our website. On our website, there is a dialysis providers tab. Go all the way down to the bottom. There's transplantation, lots of information there. But more importantly, I would suggest contacting Elizabeth at the network. There's her email address, or giving her a call, and she can help walk you through the process, especially depending on where your facility is located and what transplant centers are in your area. So that's a little bit specific for this audience, but Elizabeth would be a great resource. You can certainly contact me too if that would be easier for you. But we can definitely help provide some information there. Key takeaways for today are all facilities are required to be working towards all of our goals. This is different than the way it has been in the past. So If you have been around for many, many years, in the past, we've never had this many goals. If you feel like, oh my gosh, how many goals did you walk through? 31. It's a lot. We've never had this many, so this is new for us as well. In the past, we were able to identify cohorts of facilities or small groups of facilities to work on, and only those facilities were working on the goals and were assigned to those goals. That is not the case anymore. CMS says we want all facilities working on all of these goals. Everyone needs to be doing this stuff. So this is different for us too. We are trying to figure out the best way to manage this and work with all of the facilities on pursuing all of these goals. We're a team of 9 people, and there's 450 facilities, 31 goals that we're working on. So we're constantly reviewing how we're working with you all to let you know about these goals and how you're performing, and then help you along the way. So I will share with you that we're open to feedback. So if you have ideas, suggestions, definitely share those with us. Does not mean we can necessarily do it, but it's good to have feedback. We recently got the suggestion, which was a great one, is that when the network sends out a we use SurveyMonkey a lot for collecting information for root cause analysis, because it's easy to use, and we can set it up quickly and get feedback quickly. Is when we send out something like that, that we should send a copy of the entire survey, the entire report as a guide to filling it out, because you can't always progress to the next page to see what the questions are until you answer certain questions. So that was great feedback. We're definitely we'll start to do that. But things like that, we want to help you, so communicate with us so that we know how to do that. Key takeaway: goals are determined by CMS. We did not pull these out of thin air. CMS says this is what you need to do, and it is then applied to every facility. Individual projects may focus on just a few specific goals. This does not mean you're disqualified from having to make progress on the others. And then engage with us. The conditions for coverage require it. Here is my contact information if you need it for any reason. I am happy to talk. If you have questions, please put them in the chat. There is a question about accessing the recording to share with the team. We will get this posted to our website probably early next week. We have one more live session on Friday, and I really want to encourage people to do the live session instead of just listening to the recording. So things will be available on our website early next week, recording as well as the slide deck. Any other questions or comments? You can also take yourself off mute if you would prefer, and we can engage that way. All right, if there aren't any other questions, again, I do appreciate you taking the time this morning to listen in and learn about what the network is doing, your involvement with the network, and hope you all have a great day, and I'll talk to you soon. Please do not hesitate to contact us if you need help. Thanks so much. Bye-bye.